fulfilling the telemedicine promise with remote video-based vital signs monitoring during and post-COVID-19. At this session about telemedicine, we're going to talk about how telemedicine actually impacts the global health services and how come it's becoming the next generation for health services in general. We're going to discuss about how Binah actually fulfilled the promise of telemedicine by enabling the conversation with doctors, with remote nurses, and with any remote caregivers, with our technology, telemedicine actually moves to the next generation that allows a doctor to truly understand what a patient and what a potential patient actually feels. And those kind of monitoring tools truly changes the way that telemedicine is actually working. We're going to also discuss about how this COVID-19 situation actually changes the world today as we know it, also from a telemedicine adoption point of view. So a few words just in very high general about Binah. Binah was founded almost 4 years ago. We currently have offices headquartered in Israel and offices in the US, UK, and Tokyo. We're just passing the 50 employees. We have a dozen researchers and MDs in the companies, and we've built an amazing technology that allows us to extract vital signs remotely. My name is David Maman. I'm the founder and CEO of Binah AI. I've been doing technology my entire life. I have two amazing co-founders with me, Michael Markzon and Konstantin Gedalin, and today we're a team that's growing very fast in order to change the world as we know it from a health perspective. So telemedicine, I think in a very high level generalization concept, telemedicine means, and by the way, there's sometimes a dispute regarding whether it's called telehealth or telemedicine. In the US, it's mostly been adopted as telehealth, but worldwide, it's mostly recognized as telemedicine. The entire concept of telehealth is defined by the World Health Organization that it's about delivering a healthcare service, any kind of a service, where the patient and the provider, can be a doctor or a nurse, are at distance from each other. And using the telecommunication components that we have today and using the different technologies that we have today, we're able to actually generate this kind of a conversation and make sure that the person gets a service that usually he would have got just by getting to the clinics itself. Telehealth can contribute to achieving universal health coverage, and that's a fact that we see today, how many different organizations are struggling with the ability to know what actually is happening today when it comes to talking with a doctor, about getting a response faster and not just scheduling a session with a doctor when we're talking about sometimes a few weeks just in order to schedule a doctor. According to the World Health Organization, about half of the world lacks access to essential health services. And that doesn't mean that we're going to have 50,000 new hospitals at the beginning of next year, but it actually means that we will need to find how technology can actually make sure that this gap will be closed using the availability of new services such as telemedicine and others. Today's technology is actually nothing is new under the sun, was said many, many years ago. The first concept that is documented that discusses about telemedicine is actually from 1924, when radio news actually discussed about the radio doctor. And in this specific issue from April 1924, the discussion was about will the radio, and they even discussed about TV, as you can see in the small picture in this magazine, will radio frequencies and kind of television frequencies will be able to provide a service that companies are after in order to achieve those kind of services. So let's talk about the telemedicine usage and how come it's truly changing healthcare as we know it. When we're talking about traditional health services, eventually it's a face-to-face connection between a patient and a caregiver. It can be a doctor, it can be a nurse, anyone that can actually help him with his different types of medical situation. And we're talking about telemedicine, it means that there's distance between the two. And when there's distance, usually it's about, as a first case, as an observation. And when the observation process actually starts, the doctor will have some sort of communication with the patient in order to ask him questions, in order to see his face and his reaction, and maybe even give him instruction about how to measure a specific actions and a specific behaviors in his body. And using the different technology of telemedicine solutions today, we're talking about 4 high-level dimensions. Prevention. Prevention means that if the patient was able to communicate with the doctor in an early stage, then the doctor was able to determine actions that will help them to prevent a much worse situation. When we're talking about telemonitoring, it means how can you have an ongoing monitoring, ongoing indication, whether a specific situation you're in is getting better or getting worse. Well-being in general is about the ability to provide an ongoing treatment using the telemonitoring capabilities. And treatment is in order to have a supervising eye when a treatment recommendation was given. So in the telemedicine industry, I think we can break it down to 4 main general categories. The service itself, whether it's teleconsulting, telemonitoring, teleeducation, and even teletraining. So even training additional people from 3rd level countries or 4th level countries that do not have an advanced medical and NHS locally in their countries, but you're able to provide also training regarding medicine services. The different types, many times it's telehospitals, telehome, telemonitoring, and all those different types allows you to actually have the upper level understanding about what's going on now and how it's actually going on. Goes without saying that, like almost any other type of professions, in medicine, you have to have a special capability for a specific location and a specific environment. And what do I mean by that? Cardiology doctors and cardiologists will be able to treat different types of patients. And so on, it goes from different types of mental health, different types of neurology. So you have to have the doctors and the professionals with a specific capabilities in order to treat specific conditions. And today the delivery mode have evolved from call centers that used to be available even during the 70s and 80s, so you can have a discussion with a doctor. And today it evolved actually to a mobile experience, sometimes a web-based experience that you're able to extract all those kind of added values to your patients using remote capabilities. And we've seen that actually those kind of services that are growing rapidly during the past 4 years, when they started in the early 2010s, 2012, actually, many of them have started launching those kind of services, we see the growth that is growing actually linearly at the beginning, and now it's starting to explode. In a few seconds, we'll discuss about how COVID-19 dramatically changed the adoption of those capabilities, but this market of any kind of telehealth or telemedicine services is booming now. We've been able to see how that many of the researchers talk about that by the end of this century, when we're talking about in 40 years or so, we're talking about over 50% of the conversation with doctors will be done remotely. So we're talking about billions of communications every year, annually, for each and every country. Just during the next 4 years, we're talking about the projections for the telemedicine industry will get easily to close to $100 billion globally. And those kind of numbers truly change the way that companies reacting to telemedicine and the adoption of telemedicine services. We've seen how a lot of different physicians and doctors and nurses are starting to actually devote a lot of their time frame for telemedicine services. They can take the sessions at home, they can take the sessions on their free time, they can actually have a better lifestyle by providing additional services and getting paid for those hours and those services. And it's amazing to see how some of the leaders worldwide, such as American Well, the technology sometimes started in Israel. And we're able to provide those kind of services by enabling the technology that is available on anyone's hand today when we're talking about a smartphone. So COVID-19 dramatically changes the way in the adoption of telemedicine services. The majority of their companies and the organizations actually felt a booming in the number of sessions they're actually generating every year. In March specifically, the adoption shifted into hyperdrive with virtual healthcare. Sorry about that. With virtual healthcare, so we're talking about it looks and people predicting that by the end of the year we'll have over 1 billion interaction, and that's according to Forrester research team, showing that how telemedicine is very fast closing the gap between traditional health services and advanced health services. So using those kind of technologies, we've been able to see how China, that had less physicians per 1,000 inhabitants per country, were actually providing more and more services and more health services when it comes to the services to serve the country, because people truly didn't want to get to the doctor's office. Getting to the hospital when you're aware that there's thousands of people under COVID-19 treatment truly changed the way how the Chinese people have starting to adopt those kind of services. In China, there are four main providers in this kind of categories. Ping An, which is also an insurance company, provide good doctor services. You see how Hyangyan provides services, and also Jun Doctors. With that, there's also We Doctor, which is probably the leading in China today, and all have reported a growth of close to 1,000%, the leading one, of new users and new visits by new users. When it comes to the way and how come the importance of telemedicine, it's not just about the ability to provide you a session with your doctor. Because having a session with a doctor is important, but it dramatically changes the way that healthcare services have to arrange and manage their budgets. Because many times today, when we're thinking about healthcare services, we usually go to the point that we measure the time that it takes us to get to a doctor. Maybe because of poor transportation, maybe because of overhead over the doctor's office. But today you see how in major cities in the US, you have to wait for a doctor appointment, sometimes up to a month. And this is unbelievable because we're talking about one of the most developed countries today, and we're talking about the year 2020. And more than that, we see how researchers have named that we're going to have a shortage of over 50 million medical services professionals by the year 2030. And we're talking about just 9.5 years away. So using those kind of technology and connected health, for example, remote patient monitoring, how come the total saving can get over to $200 billion? Because chronic conditions requires an ongoing monitoring. And when the only time that you're able to have this ongoing monitoring is to drop by your doctor's office once a day or once a week, this is a huge overhead on doctors' facilities and also on medical physicians and medical service providers. So using remote patient monitoring, once you have diabetes or asthma or hypertension, and you're able to have a daily ongoing real-time remote monitoring, you're able to see a trend and degradation in the health service of each and every patient. So it's not just about reducing the face-to-face meeting with your doctor, it's actually reducing the tremendous overhead on hospitals and on medical clinics. Because using those kind of capabilities that you're able to remotely extract those kind of needs for chronic patients, you're dramatically reducing the costs. For telehealth, it's not just about the transportation, but it's also about the ability to make sure that everyone will have available health services. So the impact from telemedicine and telehealth services worldwide is huge. We're talking about annual of close to $1 trillion savings, because some of it we're unable even to measure to the impact, how developing countries will be able to adopt those kind of services. And I think an extremely important fact that we can see today, that with COVID-19 and the less developing countries that have been hit by COVID-19 epidemic, we've been able to see how they're almost hopeless without those kind of services. And it's impossible to get the budgets and to get the facilities to be created within the next few years. On the other hand, telemedicine services can support worldwide from anywhere to almost anywhere. There are countries that doesn't even have a source system up and running, but everyone owns a smartphone and is able to actually talk with a doctor. So when we're talking about connected healthcare, we're talking about how we can take all the traditional services and all the traditional capabilities that healthcare services provide and provide them remotely. And if we'll try to talk about the different type of services, so when we're talking about telemedicine architecture, it can start with a medical device. If a person is home and is able to talk with a doctor, it's great. But the only thing that the doctor can ask him is, how do you feel? How come you feel bad? What kind of changes you feel through the last few days that require you to talk with me? On the other hand, once they have a wearable or any kind of a medical device, from the most basic device to measure their temperature up to a more advanced device to measure their oxygen saturation, blood pressure, and sometimes even diabetics, and measure the amount of glucose in their blood and so on, they're able to have a completely different type of conversation. When today's we can see how data science and what people refer to as AI have conquered and is in the process of conquering the medical services, is about to have a lot of different predictions capabilities and the ability to actually make sure that when a patient is in discussions and you're able to extract his vital signs on an ongoing basis, or at least once a day or once a week, you're able to start predict what kind of a treatment will help the most to the specific patients. So telemedicine services and telemedicine application comes to use those kind of technologies that are available today in order to utilize those capabilities to make sure that the services that that patients will get, whether it's a chronic patient or a random patient that just needs a discussion with the doctor, truly changes the way they do things. And when we're talking about the missing link of telemedicine, I think that if you're talking with the doctor and the doctor can see your face, if you have a skin condition, he can probably identify the skin condition. But besides skin condition and something that is truly visible, like you have a horrible cut and you have horrible skin conditions, or you have an issue in your eyes, something that the doctors can see, but besides that, in order to understand what is going with the patient, you truly have to have the option to extract the vital signs out of the person. And today we see how a lot of telemedicine service providers are providing you multiple types of devices that will help you to actually extract all the different things that you need. I'm sorry to stop for just for 1 second, but a lot of people are raising their hands and a lot of people are asking questions. So if you can please go to the Q&A, at the end of this session, I'll be more than happy to answer any of the questions that you have. Thank you very much about that. So please leave a question at the Q&A and we'll get to you shortly. Even if I won't have the time to answer you, we'll get back to you and answer any questions you might have. So when it comes, going back to the subject, the missing link of telemedicine services is how you're able to provide the same experience like you're visiting the clinics, only remotely, which means not only ask the patient's questions. When you're getting to the doctor's locations and you're asking and the doctor asks you how you're feeling, and you're saying, I have a strange pain in the back of my head, the first thing that the doctor will do in order to determine the right treatment, he will measure your vital signs. He will use oxygen saturation measurement. He will measure your blood pressure. He will measure your heart rate. Many times he will measure your respiration rate. And also, if he have the appropriate devices, he will measure your heart rate variability. And sometimes through the discussion, he will be able to determine your mental stress in order to see if you need a better relaxation. But in the telemedicine industry today, without you owning multiple type of devices that you can actually own in order that during the discussion with the doctor, you'll be able to use in order to provide him those kind of indicators, telemedicine is really lacking those kind of capabilities. And that brings us to Binah. What Binah have done is that during the past few years, we've been developing a technology that's using a smartphone, almost any smartphone, we're able to extract vital signs in order to extract those kind of how the body reacts to different kind of conditions and situation in order for you to have a quick view, but also in order to forward them to your medical doctor or whoever is needed. So this kind of technology works over any smartphone. What you see here, actually, this is the application that I'm using. This is just a demo application by Binah. But as you can see, by using face detection, face tracking, we're compensating on a lot of different motions and we're normalizing a lot of different light conditions. We're able to extract within the first 10 seconds or so heart rate. Within the first 20 to 25 seconds, we're able to extract oxygen saturation. Within the first 30 to 35 seconds, we're able to extract respiration rate. And within the first 40 to 50 seconds, we're able to extract mental stress level and heart rate variability. All of those kind of capabilities are actually enabled on the device itself. It does not require internet connection. It does not require any information to be extracted out of the phone. By the way, the only part of information that we're truly analyzing is only the upper cheeks of the face. And why this is so important? It's important because we do not extract any identifiable features out of the person's face. I'm very happy to say that hopefully at the end of the quarter, we will be able to provide also blood pressure, and we will be able actually to also provide you the option to extract all those kind of vital signs, not only over a smartphone, also on a laptop, also to run those kind of capabilities over smart devices, such as tablets, such as smart mirrors, and so on. And with time, we will be adding more and more features to the capabilities. I'm happy to say that on our latest version that we just released, we're able to extract those vital signs by two different types of capabilities. Using the front-facing cameras, we're able to extract the vital signs in a complete contactless capabilities, like you've seen in the short video running on the screen. But what happens when the conditions are not good enough? For example, you're in bed at the middle of the night, you're in public transportation, and sometimes some people just don't want to look at their phone for a full minute or two in order to extract vital signs. So in the new version, we're also providing you the option to attach your finger to the back camera of the phone in order to extract the vital signs. So today we're using our PPG remotely using the front-facing camera, and actually a PPG when you place your finger on the back camera in order to extract it when the conditions are not sufficient. All of those capabilities, front-facing or remote cameras, were able to extract the vital signs in the same level of accuracy. So there is no problem when it comes to accuracy on both situations. And accuracy, undoubtedly, this is one of the most important questions, whether this is just a gadget or this is a medical device. So we are working. I'm very happy to say that we submitted for CE in Europe, and very shortly we should have an update regarding the approval for CE for the upcoming months. So we hope to get it during June. We are in final process with our partner in Canada with CareBook in order to submit it for Canada Health and to go to a trial in Jewish General Hospital in Canada. We are in the process for FDA approval, and we're starting a validation with the largest, I think, the most known facility in the US in Colorado University. So I'm very hope that we'll be able to get information for submission for FDA. All the different trials that we have conducted in India, in Nepal, and also in our own facility shows that the accuracy level of each and every read provide us to achieve medical grade accuracy. For any partners and anyone wishes, please contact us and we'll be able to share some more information with you about the accuracy of each and every read that we're able to provide. Those kind of capabilities today, by extracting the different vital signs, allows us actually to have a quick monitoring using the BView portal. So the BView portal is actually part of our white label capabilities that we provide to customers, but we're able to see each and every read out of the person's body. We're able to determine trend, we're able to determine the behavior, and with this kind of information, once the customer was able to use it for a long period of time, we're able also to start predictions and predicting capabilities. So with this kind of technology, we truly can change the way that medicine treats each and every patient remotely just by owning a smartphone. In today's world, there's more than 6.3 billion devices that work in production smartphones. I'm talking about smartphones, not just telephones. And smartphone means eventually that you have a front-facing camera or a back camera, and you're using a more advanced operating system, such as iOS by Apple or Android operating systems. Very soon, we will also have a version for Windows, so anyone with a laptop will be able to extract these vital signs as well as part of a standard laptop that you use anywhere. So let's get back to telemedicine and how come we're changing the way and how come the process of telemedicine services can be dramatically changed using Binah's technologies. So pre-session, whenever a patient wishes to schedule a call with a telemedicine service, today, most of the time, you're opening your NHS provider application, your health service provider, your clinic provider, you're opening the application and you're scheduling a session. During this kind of a scheduling session, the only thing that you can see is the available time frame of the specific doctor that you wish to discuss with in order to schedule the session. With Binah's technology, in the pre-session, you're able to actually have a quick scan And your extracted vital signs can help to prioritize and actually have a triage when it's being sent to the doctor. So with telemedicine services today, it's only about the connection, but using Binah technology, and I'm going to share with you with one of our partners' platform today, you're able to actually extract the vital signs in order to be prioritized. If your vital sign shows that something is not okay, you should talk with a doctor within the next 20 minutes and not only on Tuesday next week. So prioritization is a huge concern when it comes to telemedicine services, because if it's only about scheduling it according to your availability and the doctor's availability, you can have an aneurysm that you might die until the session will actually happen. So using this kind of a technology, the pre-session, you're able to have an ongoing validation even before you talk with the doctor. During the session with the doctor, once the session already started, not only that the doctor can see the last time that the data was extracted from you using the pre-session part, but he's also able to enable a quick measurement during the session. And if in the session he actually instructed you on a specific measures that you have to take, even before medicine and an ongoing treatment, just a specific action, he can actually initiate additional extraction of vital signs in order to see the influence over your body. So telemedicine services dramatically change because you're able to provide them the option to almost have the same scenario like you're visiting at the doctor's office by extracting all the different vital signs. When it comes to a follow-up and automation, if the doctors provide you a subscription to take his specific pills or have subscribed you a few days in bed, he's able to actually provide an automated notification that within the first 3 days, all the information will be automatically extracted from your phone that you will be requested to extract vital signs in order to determine whether the treatment was successful. And those kind of capabilities do not exist today. The only thing that he wishes today, the doctor during the discussion with you, he tells you, please contact me in a few days if things are not getting any better. But maybe you feel better, but inside of your body, the vital shows something completely different. And this is exactly with COVID-19, because at first everyone, and we're going to talk about COVID-19 in a few seconds, but in COVID-19, everyone was sure that if you don't have high temperature, you're fine. But the reality is completely different because temperature is not enough. So, as I mentioned before, follow-up. As a remote monitoring point of view, whether you need to go to do a lab test, whether you need a specific treatment, whether you need an ER redirections and so on, those kind of vital signs can provide also a trend analysis over the past few days or a few months. And we believe that during the next few years, people will adopt those kind of technology to have a daily scan of their actually vital signs in order to have a real trend. Because we truly believe that within a few years, it's not going to be only about COVID-19 pre-diagnostics, but you'll also be able to know whether maybe you're just getting a very strong flu and your body signs will be able to show that. So today, many times, we see how doctors recommend patients to buy multiple types of devices for you to buy at home. This information actually is some of the most sold devices that you can see, that the majority of them are not approved for usage, not by FDA, not by Health Canada, not by PMDA or CE. And the majority of devices, actually the #1 sold device for oximeter in Amazon, does not have any type of approval to be used as a medical device, but yet doctors are recommending you to buy those devices for remote monitoring. As I mentioned before, during the next month, hopefully before, we will be also releasing blood pressure. And when it comes to blood pressure cuffs, we see that the majority of the blood pressure cuffs that are being sold in Walmart, in Costco, in Amazon, in Lobels, and other locations are not FDA approved and are not Health Canada approved, which means that those devices that doctors recommend you to buy did not reach the medical grade accuracy and have not been approved by the different regulatory authorities to be used as a medical observation. And yet the majority of the doctors provides you the recommendation to buy those devices in order to scan your vital signs. So when we're talking about the different vital signs and the ability to extract those kind of capabilities, we see how telemedicine have to make sure that it will catch up with the requirement vital signs, because as I mentioned earlier, when you get to a doctor visit and you're in discussion with a doctor, the only important thing for a doctor is to truly see how your body feels, not how you feel about your body. And by extracting those kind of vital signs, you're able to have the right observation and the right treatment instruction to the patients. And using Binah's technology, a telemedicine provider can actually have those kind of instruction within a minute of a person just using a smartphone without the need to buy multiple devices that you have to store at home. And many times you don't have the right batteries. Many times those devices have went fault because they were not treated and they were not maintained. So it's a big problem that Binah can actually solve. So using Binah's technology, you're able to actually just register. And today, in a few seconds, I will also share with you with one of our partners, a full telemedicine platform is up and running today that is available for test and is available for actually acquisition. It's a full telemedicine platform as well, not only as an SDK that the customer can actually integrate inside of this platform. So once you've been able to register, you can have a self-monitoring session as many times as you wish in order to build a trend, in order to measure your vital signs in any specific situation that you wish. And then you can have an online consultant. Let's get back to COVID-19. At first, COVID-19, when we've been able to see that people were actually focused about that fever is the biggest problem and is the most important indicator to detect whether a person is sick, but we've been able to see how over 70% of the people that were admitted in the hospitals in New York and in Italy did not have higher temperature than the average person. And that's a remarkable number because that truly changes the triage and it truly changes the way that people should actually react with that. But using those kind of capabilities that Binah is able to extract today when we're focusing about oxygen saturation, respiration rate, and heart rate, a self-assessment process can be conducted by anyone at home using Binah's technology. So it's not only about the ability to scan yourself, but it's also about the ability to know whether you should contact the doctor. And from a telemedicine monitoring point of view, the online self-assessment dramatically changes the way of the instruction that the doctor can give you. Because if you have a flu, over 70% of the people that have been infected by COVID-19 and have been admitted to the hospital did not have higher temperature than average. But in a telemedicine session, the key thing that the doctor can rely that most likely you will have a device at home is in order to measure your temperature. But using Binah's technology, you can actually have almost a full observation regarding what is the likelihood of you to be infected by COVID-19. So today we see how many of the different NHSs worldwide are talking about how mental stress is one of the biggest problems that COVID-19 started and how people can assess themselves from a stress point measurement. And using Binah's technology, we actually implemented the full Bayevsky stress index. So the Bayevsky stress index was actually invented, or let's say discovered, by the Russian space program in the late 50s, and that became the standard for measuring mental stress level. The Bayevsky stress index is based on heart rate variability, and heart rate variability is based on heart rate extraction. And today, just by using the smartphone, we're able to also extract your mental stress level in order to provide you an ongoing diagnostic from a mental stress point of view. So mental stress is a huge growing situation, especially, by the way, in very developed Asian countries such as Japan and Korea and Singapore, where mental stress is truly being treated like a serious situation. In developing countries, many times when we're discussing with them about stress measurement, the majority of them have a much less priority. But stress is probably one of the key issues for health conditions, for heart conditions, and it should be treated with the highest respect to influencing the body. It will change the way that you act with your family. It will change the way that you work. It will change the way that you treat yourself. One of the key indicators for high stress on an ongoing basis is about the probability of people committing suicide or hurting themselves. So stress should be definitely treated in a different way. From a delivery point of view, from a Binah's aspect, what we are doing, we're an enabler. And today, any application service of any kind of medical services, insurance companies and others are able to implement Binah's capabilities inside of their solution. So it's not requiring you to have another application for you to use as a telemedicine service or as a remote doctor monitoring capabilities, but you're also able to ask to actually integrate all of Binah's capabilities inside of your software. And on the other hand, we're also providing you a white label platform that if you wish to have your own application with your own logo, we can actually customize it and provide you a full SaaS service. So I'm very happy to say that it's just about to launch, but we have actually partnered with SDG Group from Italy. SDG Group in Italy is one of the largest platform today, one of the largest service providers in Italy. And with SDG Groups, we've created a full telemedicine offering that is actually available now. And the telemedicine service starts with a self-assessment tool that all the information is aggregated actually to a full cloud service. And then the telemedicine service provider using the DocDot platform is able to have a quick overview regarding all of his customers on an ongoing basis. He can actually contact directly the customer through the platform in order to interact with when he sees that there is a negative trend happening per specific customer. And with that, he's providing a full interface from the patient level to the doctor level to initiate a video session or just provide subscription through the system, from an admin level so you can actually administrate the entire platform cover to cover, and the backend can actually run almost on any cloud provider or to be installed on your premises. From Binah's point of view, I'm happy to say that by the end of this month, June, we will be releasing the BView application, and BView Visual Vital Signs will be available on all stores by the end of June. And this application will provide you the option to extract vital signs remotely, and also to, during a discussion with a physician over a telemedicine or a telehealth session, to have any kind of interaction that you're interested in. So I think that the key uniqueness, in order to summarize what's Binah's unique added value, is at first and foremost, the technology can run on any device with a camera. So today, Binah's technology can run on a smartphone, can run on a tablet, can run on a PC, and very soon it will also be run on dedicated devices as well. We only use cameras. We do not require you to acquire any smartwatch or any smart device in order to extract the different vital signs. Using the front-facing camera, we're able to extract the vital sign in a complete contactless, so you don't need to touch the smartphone when we're extracting vital signs. And using the back camera, we can actually extract the same vital signs in the same level of accuracy just by placing your finger on the back camera of the device. When it comes to accuracy, we've been able to prove that the accuracy meets all the different regulatory requirements for accuracy point of view. And an extremely important fact is that the entire analysis is performed on the smartphone itself. So it does not require internet service. It does not require to violate any of your privacy. No information of medical information leaves the phone without your consent. I would like to thank you very much for all of you for showing up today. We'll be happy to continue the discussion with you. Please contact us at any time, and we wish you all to stay safe and talk with you on our next webinar next month. That is going to be extremely interesting as well. Thank you all for your time today, and thank you for showing up. I wish you all a great day, and please stay safe.